Good morning, everyone, and welcome to our All In for Kansas Kids biweekly webinar. It is February 9th, 2022. I am Debbie Deere and the Early Childhood Systems Coordinator at the Kansas Children's Cabinet. And I'm also joined today by my colleagues Hannah McGahee, who is the Early Childhood Workforce Coordinator, and Megan Broha, who is the Early Childhood Systems Specialist. And so we are happy, as always, to have you joining us on your noon hour and hope that you find the information that we are going to share out with you today useful and meaningful to your work throughout the early childhood system in Kansas. So our agenda for today will include our general systems updates that we always share with you on trainings, programs, and funding opportunities that are currently available to you and or the children and families that you provide services to. We are also going to be hearing from the Kindergarten Transitions Planning Team on a brief announcement of the program that they plan to present at our next scheduled webinar on February 23rd. And then the program today will consist of information that will be presented on the Kindergarten Readiness Quality Subgrant application process that is currently happening, as well as presentations and highlights from the current quality subgrant work that is going on around the state. So moving into our announcements, a new webinar series is being offered by the Child Care Aware of Kansas and the Child Care Health Consultant Network in response to the latest spike in COVID cases. So with limited time and resources, we know that you're all doing the best that you can to create safe and healthy environments for the kids in your care. And you definitely need to be applauded for those ongoing efforts. But we know that it's hard to do that without getting some help once in a while. So this series offers 4 sessions that have been recorded for your viewing at whatever time is convenient, and then a 5th session for Spanish-speaking providers, which is going to take place on February 18th from 1 to 2 p.m. And so you can register for that at the link that Megan has put in the chat. Child Care Aware of Kansas is also providing startup support for new and prospective child care providers in Kansas. The Child Care Health Consultant Network, again, is here to help navigate the process of becoming a child care provider. There are some eligible startup stipends that are available and a lot more information. So consultation is available, and you can learn more about scheduling your introductory meeting at the Child Care Aware website. We continue to remind you of the ASQ trainings that are being offered in February and March, and those dates are listed here. And you can access information for these trainings on the TASN website. A new child abuse training is available through the Kansas Children's Service League, and these trainings do qualify for child care licensing hours for any of you that might need some of those annually. And then dates for the upcoming opportunities are listed here, as well as some of the topics that are available. And you can register for these sessions along with many others that KCSL is offering at the website listed in the chat. The Early Childhood Recommendations Panel, as we always remind you, meets on the 3rd Friday mornings of every month from 9 to 11:30. And we always encourage you to watch that on the YouTube channel for the Children's Cabinet, if those are recorded live, or they're also on the website for you to go back to look at later on if you need to. And we encourage you to provide either verbal or written feedback for those. And you can do that by contacting me at this information listed here. by the Thursday at 5 o'clock prior to each month's meeting. And then we'll be happy to coordinate those comments getting out to everybody from you. This month, we are scheduled to meet on the 18th, and we are going to hear some information presented by on the Family Engagement Toolkit, as well as on the career pathways, and then the work groups that we have been ongoing for the past several months in these focus areas are going to be meeting, finalizing their draft recommendations, and then spending about the last hour of the meeting coming back and reporting those to the full panel for discussion and revisions. And then hopefully, if all of that goes well, they will be finalized completely and voted on at the March panel meeting, and then elevated on to the Children's Cabinet in April for consideration. I am now going to ask Kim Kennedy, the Head Start Collaboration Director for DCF and today's spokesperson for the Kindergarten Transitions Planning Team, to hop on here and give you a brief overview of what they have planned for their presentation coming up on February 23rd. So Kim, are you here somewhere?
Yes, I'm here, Debbie. So good afternoon, everyone. As Debbie said, I am Kim Kennedy. I am the Head Start Collaboration Director with the Department for Children and Families. And we are excited to announce the February 23rd All In for Kansas Kids webinar will focus on kindergarten transitions. The Head Start Collaboration Office and the Kansas Head Start Association will be hosting an opportunity to learn more about the 4 points of connection that are essential for effective kindergarten transitions. And these 4 points of connections are child to school, family to school, program to school, and community to school. During this time, we'll share information regarding practices that communities across Kansas are utilizing to implement effective kindergarten transitions and how you can start to strengthen this work in your community. So we look forward to seeing you at the next webinar. We will have lots of wonderful information and examples of great things that are going on in the work of kindergarten transitions across our state. So we look forward to seeing everybody February 23rd. Thank you, Debbie.
Thank you, Kim. And this planning team has been working very hard for the past 2 to 3 months on making this event happen and making adjustments along the way, and trying to make it the best it can be for all of you to get the information you need to successfully do this process in your communities. So we look forward to that, Kim. And now we are ready to move into today's presentation segment. And I want to welcome Megan Cluth, Barbara Ganaway, and Tracy Dotson, who will be presenting information on the kindergarten readiness quality subgrants work and the funding opportunities that are available right now for this upcoming year on that. So I think we're going to start with Megan.
Thank you, Debbie. Thank you for allowing me to share a little bit of the great work that our subgrantees have been up to. If you're not familiar, the Quality Subgrants was a new funding opportunity that started in fall 2020. It is part of our PDG work, and it was the first grant opportunity to use the Kansas Common App platform, which has now been used for many funding opportunities across the system. We've had 167 applications submitted to date, and you're going to hear a little bit about 2 of the funded projects today. Next slide, please. So 75 grants have been funded to date across 5 categories: childcare access, rural childcare, connecting families, kindergarten readiness, and improved quality of care. So pretty broad categories. Again, you're going to hear from 2 of these projects today. I get the pleasure of hearing from all of our grantees on a regular basis, and I will just say that there is some very, very exciting work happening across the state and all different focus areas in different parts of the state, and I'm really excited for you to hear just a snapshot of that, but I'm going to tell you about how you can learn a little bit more if you want to hear about some of the other projects as well. Most of these are multi-year projects, so we are currently in year 2 of PDG, and so most of them will run through year 3, which wraps up at April 2023. Next slide. So it's very, very hard to capture what 75 grantees are doing on one slide, and I'm not going to try to do that. But to give you a sense of the breadth of things that have been funded through the subgrantees, we have some projects that are focusing on increasing capacity and quality of childcare, expanding non-traditional hours, providing culturally responsive materials, and increasing accessibility for children. We also have several groups that are working on community collaborations, bringing partners together to talk about all things early childhood and really strengthen that community-based approach. Many grantees acknowledge that workforce is a big issue, and so are looking at ways that they can address turnover and recruitment of their workforce through stipends, professional development, looking at health insurance, things like that. So there's a lot of really innovative and interesting work going on at all levels across the state. And if you'd like to learn more about each of those projects individually, if you go to the next slide, there's a link to a map, and you can see across the state by category all of the different projects, and then there's the scope of work and the counties that they're serving. So I would recommend you take a minute and take a look, see what's going on in your community. I think there's a lot of opportunity for collaboration with some of these projects, and would really recommend you reaching out to them and learning more, because there is so much great work happening. Next slide, please. Thank you. And before we hand it over to our grantees to present, I want to share that there is a new subgrant application opening this Friday, February 11th. So one of the categories for our subgrants is kindergarten readiness, and these are one-year grants, so 12 months starting at the end of this April. The purpose of these grants is really focused on community collaborations around the successful transition of children from early childhood settings into kindergarten. And people have submitted a variety of approaches to what this looks like, but really it's a very collaborative grant process and about bringing partners together to address kindergarten readiness as a whole. So again, the application opens this Friday, February 11th. There is technical assistance available starting Friday as well through March 16th, and then the application deadline is March 18th. Again, it's a 12-month grant period, so these projects will run from the very end of April through April 2023. We have $250,000 total available, so the maximum single award amount will be $25,000. And this list gives you a sense of the types of groups that maybe are part of the collaboration or may be applying. This is not necessarily a fully exhaustive list, excuse me, but gives you a good sense of the collaborations that have applied in the past. There is an application guidance document and a frequently asked question document, as well as a link to the actual application, which is again on the Common App and on the technical assistance form. You can find all of that on the link here below. So I would encourage you to check it out and perhaps consider applying.
Hey, Megan, we have a question in the chat, and I think probably easiest for you to just answer it instead of letting us bumble around and try to answer it. So the question is, can a district apply again if they have, I assume, already received a grant? And I'm assuming this came out during the kindergarten readiness information. So I think that's what they're referring to.
Yes. People who have received the grant before can apply again. It should be a distinct project and not necessarily just a continuation. I would recommend anybody who has specific questions on that, feel free to reach out to me or to our technical assistance team, and we can certainly talk through what that might look like. But yes, you are eligible.
And oh, sorry, one more flag, just real quick. I thought it was very neat that some of the technical assistance that's being offered is actually to help people flesh out ideas as well. So, I mean,
thank you.
I would say,
thank you for
please take advantage of that.
Absolutely. If you're thinking about applying, I would really recommend you consider reaching out to our technical assistants, because, like you said, Hannah, it is for truly technical questions, as well as kind of finding out, is this the right fit, and certainly worth a quick conversation to see if maybe this could be a good fit for you. Are there any other questions? Okay, great. Well, I saw Debbie put my email in the chat, so please reach out if you have any other questions. But with that, I'm very excited to hand it over to Barbara Ganaway and Bonnie Hauk from Greenbush, who are going to share about their subgrant project.
Hi, everyone. I'm Barbara Ganaway, and Bonnie's on here as well. My position at Greenbush is a family engagement consultant and also early learning consultant as well. I thank you so much for this opportunity to share our project with you. We greatly appreciate the opportunity we've also been given to be able to do this work through the funding of the grant. Ours is titled Family Connect Modules. And just throughout this, should you have any questions, don't hesitate to speak up in chat, and Bonnie's alongside as well. She said, oh, Barbara, you can do this, but she's going to chime in, I hope, as I go through this in case I miss anything. I just really wanted to give you, first of all, a brief history of what this grant is about. If you could go to the next slide, please. Thank you. We had created back in 2014 through a grant that was written by multiple early childhood professionals throughout the state. It was written for a W.K. Kellogg Foundation grant. It was awarded, and it asked that we develop family engagement and partnership standards for early childhood. Now, we have those in place for kindergarten through 12th grade and post-secondary, but not specifically for birth to 5. So that's where it began. We created the standards, and then through a grant with the PDG in 2019, we were able to revise those and create another resource. So we had 2 resources, but the second resource updated gave more information. And specifically, these 2 opportunities were to help primarily practitioners, educators, care providers, and so on. So what this new grant through this subgrant has allowed us to do is now connect families to the family engagement and partnership standards, where they understand that they're a key, they have a very important place in family engagement, as we know, and we've said families are their child's first and foremost teachers. So we wanted to help them understand the standards and understand more about how they can contribute to the growth and development of their child. So we created modules, and there are 5 modules. One focusing on each of the 5 standards. Basically, they consist of 3 to 4 sections. Each section has resources and information, followed by quizzes and activities for the families to do while they're completing them, and also caregivers and so on. And then at the end, we ask for an evaluation and also a completion of a W-9, because as part of our grant, we felt like it was important to provide not only incentives, but to support families who did this. So each family or person who completes these is given a $25 stipend per module, totaling up to $125 over the period. And so that W-9 is sent to our office. So I suppose you can imagine some of the logistics of this, but is very smoothly running thanks to Bonnie and the team in research and development and so on, all based in Girard. So anyway, that kind of gives you a bit of a history, get a bit of a framework of these. So let's just kind of dig in on the next slide with understanding the content. Our first module is all about families as foundations, where we recognize and promote them as their child's first and foremost and influential teacher. It provides parents, caregivers, and others information to basically help children grow and learn. Specifically, as I mentioned, there's activities and resources, but this one includes how to write a family mission statement, and it also directs them toward the Center for Disease Control. That's only 2 things that are included in this, but I'm just wanting to highlight a few of the things, and then if you have any questions, don't hesitate to ask. But it's really geared to help families understand what their role is to provide that foundation for their children. in these very important years of birth to 5. So as of January 31st, we had 310 completers, and that gives you a breakdown of who completed them, primarily caretakers and parents or child care providers. Then we have that in an evaluation component that just says, how helpful were these? And was this particular module helpful to you? 35.6% said helpful and 56% said very helpful. And we also get opportunity just to hear from folks. You know, I get calls on a regular basis to say, wow, I wish I would have known this, or I'm so glad I have this tool in my toolbox to help me be a better provider, and so on. And then after, in addition, we ask them, now that you've gained and learned this information, how confident or very are you in understanding it, connecting it to resources, and about the ability to use the knowledge. I will say, and thank you, Natalie, for the question. Each module should take a family approximately 1 hour to complete. After they've completed the module, they each get a certificate as well. So just to highlight that specific piece, and that certificate lists the date of completion and the hour or hours. Oftentimes families sit down, or some might complete them all together. And so we can, that's 5 hours of possible professional development. We've had quite a few preschool folks that are completing it for their continued learning, and also foster families. So they do get a certificate indicating the time and that they took to complete this, and also the date of completion. Next slide. The next standard is families as communicators. And this one basically promotes effective two-way communication among families, educators, practitioners in the community, and it provides ways to help build that relationship with one another. So in this particular section, we also emphasize the importance of what we do as providers, but also as family members. How do we open that door for two-way communication? In this one, we gave an overview of 1-800-CHILDREN so that families had access to all the wonderful resources available through that. We had a recorded presentation from KCSL on 1-800-CHILDREN. We also asked at the end that they gave us or participated in our Tomorrow Stories collection, so we could hear their story. And again, those are just a few. And then again, mixed in with some more activities and quizzes. You'll see there as of January 17th, how many completers and who completed, and then the helpfulness, and then the confidence and how they can use this material and connect it to the resources. Next slide. Families as advocates. This particular standard really wants to provide parents the opportunity to learn and refine skills to better advocate for their child in an educational setting. They gain an increased knowledge of how to help families become more engaged in their child's early learning experiences, to empower them. And we always talk about that in family engagement, to learn how, to feel empowered so they become stronger advocates. We partnered with the Kansas Parent Information Resource Center, a place I'm very familiar with. I spent 10 years with KPERC, and I have met a lot of you through that, and continue that with my work at Greenbush. But that is something that what we did, that KPERC had established interviews with parents who advocated for their children. And so we were able to include those. And after each interview, we offered quizzes and some additional resources. So there you will see again the number of completers and the helpfulness and the confidence level. The next standard, the next slide would be family says, we gotta go to the next slide.
Partners.
Oh, sorry. Appreciate it, Hannah. Kind of fumbled. Families as partners. They learn how to build strong and effective partnerships that can help children and families thrive. Partnerships are grounded on positive, ongoing, and goal-oriented relationships with families and providers. And the relationships are based on mutual respect and trust and are developed over time through multiple methods of communication. I don't know if you're seeing this, but there's kind of an overlap with these standards. So we worked really hard on trying to provide information and resources that didn't repeat. But again, KPERC is another wonderful resource to help families understand how to build partnerships. They have one in particular resource of working together that we wanted to include for families and care providers or whomever was completing these. And we also linked them to TASN. So just to highlight here, throughout this project, we wanted to make sure we brought in as many partners as possible to share, but also to let families know and care providers and so on, all of the resources they have access to. Again, the number of completers you can see, helpfulness and confidence level. And the last standard was families as community members. And this one was really kind of fun too, but it's just to help families learn how to be active participants in their communities and learn how to connect to these resources in their community. We had a presentation from parents as teachers in this to know how to access that potential opportunity, but just gave them often a list of ways and ideas of what they could do to become involved in their community and to connect with their child's school or the many other resources. So that was kind of a fun one to end on. And we had pretty good indication of this one was helpful as well, and the confidence level after they completed it. Overall, this is just a real quick graph that'll tell you the number of children along the bottom that these families support. And so you'll see that some of them are just families with 1 and 2 children, and then on up to care providers or families with more than 5 children. I also wanted to emphasize there's been quite a bit of interest in foster care families because they are able to receive professional development credit for completing these and have found them to be quite helpful in that regard. So as of 31st, we've had 938 completers. And you'll see the number of caretakers and child care providers and the confidence level and the helpfulness. And so we feel like it's just been a really worthwhile project. And my favorite part of what I've been doing is fielding phone calls and emails of how do I do this? And then thank you so much and so on. So those are the kinds of things that I enjoy hearing. And I think just have proven that these have been effective. The next page shows us how many counties we've reached. And I go back to our Tomorrow stories and how we wanted to reach at least one person in every county. And that's our goal as well. So I think we have quite a few of you on here. And if you see your county, reach out because I know there's folks in your county that could benefit. Once again, there are the stipends until that funding runs out, but we've allotted additional funding through the help of Megan and her team to be able to make sure we're able to do this. So that's a listing of the counties. And then lastly, oh, McPherson. Okay, we want you, McPherson. So, all right, we'll be glad to send you information. So this is my contact information. There's also the way to access the website that you go straight on here. I'm going to just show you if we could open that flyer link, and this will be quite helpful. I don't know if that's possible or not, Hannah, or if not, no worries. But what this link is simply to take you directly to a flyer where the family just has to place their cursor over the title of the module, and it'll take them straight to that page.
Not quick, but I am going there.
It's
And
okay.
we have time,
If you
so
don't,
we're there.
well, all right.
Yeah, no, you're totally fine.
Okay.
We do have a question, Barbara, that you could
Okay.
answer while we're waiting. Do these offer KDHE clock hours to the child care providers who participate?
Currently, they do not. any KDHE folks here. We are working on that. That would be our next goal, as we've written for a third year, to actually create 3 more modules. And then to make this sustainable, that's in our dream, to have these as KDHE clock hours. So I'm that's in our thought for the third year. Anything?
I'm not able to pull it up, but
Okay,
if one
no
of you could,
worries.
if you can send it to me in a link, we can pull it up at the end of the next presentation. I think we'll have time, no issues.
Okay,
So
it's okay.
yeah.
Thank you. And you're welcome to email me. If you'd like that, I can send you that flyer. In addition, we have a postcard that we have printed. So you could also email me and say, hey, could you send me 100 postcards? And they have a QR code to access the modules. And also they have an explanation of, they can go enter the website and then go straight in that way. So 2 different ways, but it is a postcard. So I'd be happy to send those to any of you to share throughout the state. But thank you so much. I appreciate your attention and the opportunity to share. Any other questions? Okay. Megan, does that kind of cover things? Or you okay?
Yes, that was fantastic. Thank you so much, Barbara and Bonnie. I'm thrilled that other people get to learn about the great work you all have been up to for the past year and a half, and I know there will be more to come over the next several months.
And I meant
so
to
thank
ask,
you so much for your time.
You're welcome. I meant to ask Bonnie, did I miss something?
No, you didn't.
Nope. I got to tell you, Bonnie is, quiet, but she's a wonderful, wonderful colleague that's helped so much. But thank you all.
Of course. All right. Next, I will hand it to Rich Minder and Tracy Dotson, who are with Success by 6 Coalition of Douglas County, to share about their subgrant work.
Yes, thank you so much for giving us the opportunity to share about our project today. I'm really excited to be talking with you all. So just starting off with our project is called Doulas of Douglas County. It is a threefold project. The Doulas service is kind of one of the bigger proponents of our work, and mostly what we'll talk about today. There's a picture of our doulas there. I'm the project manager for this group. We sent actually, I'll get into that later. We can just continue to the next slide. So just some background information, kind of where our project grew from and what the need was. Recognizing that the United States has one of the highest or the highest maternal mortality rate among other developed countries, and that most of these deaths are preventable, and that a disproportionate amount of these deaths occur in Black and Indigenous women, that's just unacceptable, so we started to kind of take a look at, and there's been excuse me, a lot of efforts in our community to kind of come together and do focus groups and see kind of what the community's thoughts on some of these issues are, as well as pulling in providers and their perspective. And so really just recognizing that there are both societal and system factors that are playing into these poor health outcomes for Black infants here in our community, and then Black women and Indigenous women. And Rich will share more about some of those specific numbers. But when we start looking at an explanation for these numbers, we see that one of the greatest impacts are racism. And it's not just racism that's occurring during pregnancy, it's over the spans of people's entire lives and in their everyday interactions. So like the chronic stress that people of color in the United States are enduring, and how that is providing like detrimental impacts on multiple generations. So that's kind of just a quick look at the system and where that started. And then we dig into patient and provider relationships and what's available in our community. We have a deficit, as fair to say, of midwives in our community. And midwives are the people that tend to focus on those normal, healthy pregnancies. They kind of prioritize a more natural process of the entire reproductive process. And so those are the people that we see in birthing centers and tending to home births versus OBGYNs that are physicians. They're the ones that work in hospitals. They may identify and intervene more often and take a look at abnormal conditions during pregnancy. And so these are the people that also perform cesareans. So there's a big difference between midwives and OBGYNs. And then doulas are a total other wheelhouse. So we'll get into that too. But just recognizing that there is a shortage of midwives, which are the people that we should most often be relying into or relying on for these healthy pregnancies. And so not just recognizing the shortage, but also the shortage and specifically people of color in these positions. There are very few Black and Brown midwives and OBGYN, and that's across the nation, but especially here in Kansas. And so we recognize that this shortage does play directly into like one of the major issues that our doulas run into in families experience, and that's women feeling like their concerns are being dismissed. They're not feeling informed and not feeling autonomous. And this is going through pregnancy, labor, delivery, and even the postpartum period. So you layer these issues on top of it. You layer these issues on top of the day-to-day racism, and it pretty much leads to a traumatic pregnancy, birthing experience, et cetera, for the women. And this is physically and emotionally. I could go on and on and on about this, but like for people who do have these birth experiences, birth dreams is what we talk about, their wishes, and not feeling informed or not getting all of the information, and then we talk about emergency C-sections and the rate that happens at among Black women, and that there's a mourning process in that, not having the birth that you expected and now healing physically, that's tenfold, and that process looks completely different. So we start talking about those kinds of things and recognizing that, you know, these concerns do align with a lot of the research that we see. So there was a study in 2017, I think it was Medscape, and they recognized that 34% of OBGYNs are on average are spending like 13 to 16 minutes with their patients at each visit. And I don't know, but like for me personally, coming from this social work realm, 13 to 16 minutes is not enough time to build relationship, provide education. You know, if you're not bringing up a concern, it's not being addressed essentially. And also recognizing that it's not solely the provider's responsibility to do that. So there's some self-education required and self-study, but then also the role of community and where we can come into play. And that, you know, pregnancy and parenting, these are hard things, and everyone deserves a village and support in that. So we grew from this need, essentially. We can go into the next slide because I want to be cognizant of time. Rich will go kind of over some of the birth outcomes really quickly, I believe.
So very quickly, in Douglas County, Black babies are born at a low birth weight at more than twice the rate of white babies. So it's 13.7 versus 6.6%. So in Douglas County, Hispanic babies die at a rate of more than twice the rate of white infants at 13 per 1,000 versus 6. And nationally, Black and Brown women die from pregnancy or birth-related complications at a rate 3 to 4 times higher than white women. An interesting statistic or interesting numerical way of looking at this is that something that was interesting to me, and that was that birth outcomes among Black women, Black mothers with higher incomes and more education are worse than the birth outcomes for Black mothers with lower income and lower education. So that is a really interesting number to describe what we're looking at. And then in 2018, this is statistics around accessing prenatal care. About 70.5% of Black women and about 69.5% of Native American women sought prenatal care in the first trimester, compared to about 85.5% of white women. So of the 216 non-white babies that were born in 2000, from 2012 to 2016, and And I think the 72.5% of Latinx women were seeking prenatal care. So those are some numbers to also describe the problem or opportunity that we're working on. Next slide.
And so a major part of our project or work was recruiting a team of doulas to respond to this need for birth and social support for Black women in our community, Black and brown women in our community. So pretty much after my position, I jumped right into recruiting doulas. Or people interested in training to become doulas. And after about a month or so, we had a team of 6 that was prepared to go to training. And so our project was able to support that, the training of those doulas. And that training was very intensive. It was a month long, which we actually pushed it into a month. It typically takes 8 weeks, but we just knocked it out 8 full days. So over the weekend, full days, and then there's self-study, some exams, teaching demonstrations, things like that. So then everybody passes that process to be trained, and now are in the process of seeing clients and engaging with them. They have to get feedback on their birth support and amongst the other list of things, and that will lead to their certification. And certification is what will gain them their acronyms of a certified doula, and also just the ability to kind of do a little bit more with their work and saying that they're more experienced. So right now, the focus has been really just getting the experience and supporting the families. So the doulas are all women of color who live here in Douglas County. They do come from a variety of backgrounds. I think it's fair to say you can just look and see that we span all ages, ethnicities, and everyone brings something really unique to our team. We do have a doula that is Spanish speaking, so she works with a lot of our immigrant families, and that is a huge population that we serve. I think about 40% of the families that we're serving or intend to serve would fall into that category. So we're also kind of recognizing a need for maybe an additional doula that speaks Spanish, but also recognizing that that's a community that we have to engage in different ways, and that the people that we want to do this work, building trust and rapport with them before, as we bring them in is a major step that we have to take. So most of the doulas do have full-time jobs outside of their work as a doula. So it's fair to say that they're very busy people, but don't let that take away from their drive and passion to serve this community. I think they're a group of go-getters and really are committed to making a significant impact for the families in our community. So the doulas graduated their training in June, and then our first baby for the collective was born in July. And since then, we've had clients come. We do accept them either prenatally prior to birth, but also postpartum. So between all of the families we've served, we have 20 birthing families that have given birth, 21 babies, so a set of twins, which is really exciting and was so sweet. And that doesn't include our pregnant families that are currently engaged in services. So we are touching a small portion. Our numbers are big for a small group of 6 women, but we are reaching a pretty small portion of this community. There's such a huge need out there. There's no way that our collective could address the need all in just this 2 years that our grant has been here, or we've been receiving this grant. And nor could it just be the work of 6 women, but they are trailblazing and leading those efforts. So that's something that we are really proud of. The doula services, what those can look like, really varies based on where that person is in their pregnancy or postpartum period, and also what their needs are. So the doulas do visit with people mostly in their homes. We are flexible. Sometimes we'll meet in the community in different spaces, and then occasionally the hospital will tend prenatal visits, postpartum visits, et cetera, things like that with the families. And then of course, birth is in the hospital. But again, like I said, the visits vary. They really work on identifying areas for support for families. A lot of our families have older children, so things like finding childcare for that child when I go into the hospital, or even just respite care as I'm adjusting to having an infant. taking time off work. We piloted or are working, have a paid leave project that the doulas are able to offer families. So that support that comes postpartum, we found for families and what we hear from them, it's totally unique and insurmountable. There's really no way to put, it's the qualitative data that we'll get to talking about. There's not a number for the experience that the doulas provide and the support that they provide. I think that for me, the biggest thing in the postpartum visits, or that I like to really highlight in the doula's work, is that they're fighting the stigma that as women and birthing people, that you have to be this superhero in the postpartum period who takes care of your baby and you're breastfeeding and you keep a clean house and your partner goes back to work and you just handle it all. No one should have to do that alone, whether you have a partner or not. You deserve additional support, and that's what our doulas have came in to do. And a lot of the time, and it's not additional support. We've seen our doulas be the only support, and I'll share a story about that a little bit later. We can move forward to the next slide.
So some of the connections to services, some of the things that we've been working on, obviously the preschool development grant has been an enormous advantage, just being able to have the leadership and the management of Tracy. We did receive a local grant from a local foundation, Be More Like Claire, for additional stipend money for the doulas. Tracy mentioned the 12 weeks of paid leave that we get funds from the United Way. We have been helping families with rent and utility assistance to supplement that paid leave funds to help postpartum leave time. Just recently, we developed a relationship, or we're developing a relationship with an insurance company and their national partner to work on a sustainable partnership to help us sustain the project and the program. Also, we're working on a proposal with the National Network of Libraries of Medicine on a campaign to has 3 parts of information-related projects related to the need and improving relationships with providers, increasing the capacity of the doulas to provide additional services and connections for families that they work with, and an overall community awareness campaign around birthing bodies, Black bodies, and immigrant families that we're serving. So that's something that we're really excited to be a project that we're working on. Next slide.
So moving into kind of some more work of the doulas and myself is the building of a community and solidarity among the families that we serve. And so again, this is twofold. So it's within the families, but also with the providers and other organizations in our community. So these relationships, they really vary. We have supporters and people who are investing in our project, but then we also have our referral sources and community partners and people that we collaborate with. Then we think of community members, and then service providers like nurses, doctors, midwives. And then, of course, most important is our families. And so just understanding that everybody, all of this, everybody's valuable and has a function or part that is really unique. And so similar to the doulas, and what I believe, everybody has a function and brings something unique to this all. Solidarity, building a sense of community amongst the doulas, that was something that I think training really did naturally. Being able to go through that process together really brought the group together and built a sense of sisterhood, is what I have always said, and I think is echoed from the group. But also, so understanding, you know, they're the core of this work, and I think that they model community and solidarity well. They support each other outside of the doula work even. And so attempting to extend and bring our families into this really mutually supportive network is the goal, so that we're not parenting and going through these moments alone. some major challenges in building this kind of sense of community has just been COVID. I would think is our greatest challenge. We really like and want to meet in person as much as possible, but of course have to be conscious of and do our part and not spreading COVID and not exposing people who are really vulnerable. That's the reality of the population we're working with. They are birthing, and the process of even getting into the hospital to give birth, that there's a screening for that. And so there are challenges in that. And then also recognizing, there are times when people have to make hard decisions about who's there for your birth support, because the hospital does have policies around how many people can be present. So those are some of our greater challenges. And then, of course, building rapport with our families, people who haven't necessarily, the doulas did really good recruiting families themselves. We've had service providers making referrals, and those connections have been well, but some of those kind of cold connections, we call them, is like the really unsure of like, what is this new project? Who's behind it? How long is this going to last? And even questions about eligibility, like, going back to what Rich was saying about income and education not being something that impacts or has much impact on if you have a positive birth experience as a Black or brown woman. You can be middle to upper class and degree holding and still experience worse birth outcomes than a white woman without a degree and of lower income. And so recognizing that we take everyone, we don't have a qualifying like income barrier or anything like that. Some opportunities for community building that we've recognized are like a shared approach to childcare, and we'll talk about that, offering play groups and different parent support groups. And again, these things become challenging with COVID, doing them virtually, it's not the same feeling, but we are really working to make these things happen and make these connections with our families, and so that they can connect with other families. We've explored the idea of like a retreat for Black women, Black and brown women. And then of course are really focusing now on fundraising and making our project sustainable and keeping our project sustained. We've done some reaching out to different partners and routes of support, and are working to develop those relationships. So that's a big part of the opportunities and kind of future planning for us. I think we can move to the next slide.
So yeah, so in terms of outcomes, obviously some of the outcomes are going to be quantitative outcomes, birth outcomes, things like that that you can measure. And then, I think I wanted to kind of speed this up a little bit because I know that we're going a little over time here, but the qualitative outcomes are the ones that Tracy talked about, that you can't necessarily count them. The relationship, kind of advocacy are you getting done, and what sort of systems change are happening. And so I guess that's sort of briefly how we're approaching measuring outcomes, is both quantitative birth outcomes and then also sort of systems-wide changes. Relationships around working together as a group of families that were served by doulas to get your childcare needs met is something that we're working on right now, to try to figure out how, as a group of consumers, we can figure out a better way to get infant care needs met. Next slide.
I think that we've kind of started to talk about a lot of these things, just really growing and sustaining our project, which a major part of that is the doula compensation, but also thinking of like continuing professional development opportunities and education for them. And then the child care co-op, so a shared approach to infant and toddler child care, that the doulas and the families that the doulas serve are probably the best equipped to care for their babies. And then sustaining my position and other roles of leadership and management for this project. Next slide, please. And then more future kind of plans for us is, of course, the continued advocacy and showing up in spaces to share our work and get continued support, education, and resources. That's a big part that we've noticed coming from our supporters, is that there's an additional, I won't go into that, actually, being cognizant of time. But if you have more questions about that, you can reach out to me. And then, of course, a place of our own. So right now, Rich and I we're a Success by 6 employees, and we have a space that doesn't necessarily scream inviting for families. And so trying to find a space for families and doulas that is outside of the home, outside of the hospital, our own space for community. We've taken a swing at some different funding and opportunities for that. So we are excited about the work.
Yeah, we're also collaborating with Centro Hispano on a place where their care coordinators and the doulas can share a space to meet with families.
Yeah. And last thing was questions, which I don't know if we have much time for, but if you'd like to reach out the next slide, those are sweet baby hands, one of our sweet babies. You can reach me by email, phone, and then, yep, there they are in the chat. So
We have a couple of minutes, so you guys are fine. If you want to take a few questions or if you want to go back through the chat real quick.
Yeah. Scrolling through chat, looking for questions. I do appreciate all the feedback.
You're getting a lot of complimentary shout outs from people just saying what good work you're doing and that the information that you're sharing. So that's a great thing.
I think there was a question around education and socioeconomic status statistics. Are you able to speak?
Yeah, I was actually me. I was kind of curious. So Rich, it sounded like you said that as the socioeconomic status increased and the level of education increased, was it that it didn't statistically affect the birthing outcomes or that it made it worse?
Yeah, you know, I wish I had a source on this, but my source is actually my source is Erica Hill at LMH. And unfortunately, I don't have the source on that, but that it's actually worse, the overall worst birth outcomes for Black and brown women who have more education and higher income than for lower income, less educated Black women. So the implication that has been shared with that statistic is that there's something about the stress of being upper income and more well-educated for Black women and brown women in the environment, the social environment that they're in, that causes worse birth outcomes. And, you know, this sort of cause and effect thing, I'm really trying to figure out what cause, I mean, these are like, this phenomenon must be multiple causes because, you know, healthy families and others have been working at, you know, good prenatal care for a long time and we haven't moved the needle. So what's causing it? And it has to be something more than prenatal care when you look at statistics like that. And we hope that relationships are a way to get at that. Supportive relationships of people that you feel that you have common cause with and solidarity with. I don't know, Tracy, do you have a source on this?
Yeah, I can send that source. I'm looking through.
No, I just want to make sure I heard that correctly. I mean, now that I'm thinking about it, it makes sense because they would have different like social stressors and, you know, maybe a sense of otherness even within their own culture because the environment looks so different. But I just want to make sure I heard that right. And I'll have to do some digging of my own.
Thank you all for your time.
Well, thank you so much for all of you that shared the work that you're doing. It's just a great example and hopefully motivation for those of you that are out there maybe interested in applying for the new grants that are opening up tomorrow to do some of this kind of work. So keep up the good work and thank you. It's been great hearing from all of you today. And so we're just wrapping up the webinar this morning or this afternoon, I guess we are now, with just our reminders of upcoming meetings. I mentioned the Early Childhood Recommendations panel meets next on February 18th in the morning from 9 to 11:30. Our next webinar is on Wednesday, February 23rd. And so, I'm sorry, I was freaking out that maybe my mute was on, so never mind. And we meet February 23rd, and that again is going to be on the kindergarten transitions planning presentation. And then the Children's Cabinet and stakeholder group meetings are scheduled upcoming for April 1st. You can always register for the stakeholder group meetings at this link. And then we also welcome you to share any feedback that you have at any time at the KansasChildren'sCabinet.org. So thank you. I have 1 minute, so I'm going to forewarn you that I have picked a silly joke to share with you today. And it's because my motivation was Valentine's Day coming up, and maybe all of the cute little Valentine's cards that all of the kiddos that are around you are working on for Monday. So it is, what did one watermelon say to the other on Valentine's Day? You are one in a melon. So sorry for that, but I just thought it was cute. And we just want to let you know, as always, that the work that you continue to do for children and families, highlighting the ones that shared information with us today, we appreciate all of that, and you are our one in a melon. So we hope you take that away and have a great rest of your week. Enjoy the sunshine and maybe Valentine's Day plans if you have any, and we will see you back here on February 23rd for our kindergarten transitions planning presentation. So goodbye, everybody.